As a doctor and the director of a hospital, in this, just as I mentioned in the opening remark, in these economic challenges that we are facing in Nigeria, how are you coping with your practice?
Well, it has not been easy because we started, like I told you, we just started like 4 months ago. And unfortunately for us, when we started, that's when the economy started dwindling. So it has affected a lot of things. You know, some of the things, equipment you need to buy, the prices have gone up. You get it? So it increased your startup capital. You go to the market today, you want to buy drugs. Prices of drugs have, in fact, in some instances, they have tripled. So, the inflow of patients also. A lot of people that are sick will not come to the hospital because they want to feed first. A little money they have, they want to use it to buy food first. And so you eat food first. After the one remaining, that's when they will come to the hospital. So when they come to the hospital, and a lot of things, you provide your services, time to pay, you just see the patient cannot pay. You get it? So a lot of things, a lot of challenges that is affecting the practice, especially private practice. But you see, things like that, you have to face the challenge. There are times that I remember when we started, we take our consultation and cut at a particular amount. But when we look at the hardship people are going through, we reduce the cost of general consultation and cost of getting cut. We reduce it by about 2/3 the price.
Wow.
You get it? But we did that from October to December. But you have to pay staff.
Yeah,
you get it?
definitely.
And your staff are also experiencing the hardship. So if you look at it, they want to come to work, and so there are so many factors. There are interplays of a lot of things. But as much as possible, we try to strike a balance. Now, another aspect that we really have, you know, Nigerians, our problem is we are not keen on health insurance. Health insurance will have come up handy at this time. Because if you have health insurance as an individual, it makes it easier. You don't care. All you need to do is paying the insurance company a premium, maybe monthly or yearly. And then when you fall sick, you just walk into your hospital. The hospital, once the hospital is with your primary area, or if it's a secondary care, you are referred there. You come, you get your treatment at free of charge. The insurance company will pay the hospital. So around this period, most of the time, it's the insurance patient that sustain the hospital.
Okay, but since I know that hospitals used to register to be part of the scheme, and you say you just started. Have you been able to register with the government so that?
Yes, you know, here in our setup, we believe in following all regulations.
Okay.
We became fully registered before we even started. Then, but the insurance, already we have been onboarded. We've been accredited by the State Insurance Authority, which we call CACHMA.
Okay.
So if you're a CACHMA enrollee, just know that EPSON is here for you. Apart from the packages CACHMA is giving you, we also have some value-added services as part of our corporate social responsibilities. So you can just walk into the hospital and then pick a form and then choose us as one of your hospital. NHS have already come for accreditation, and they are already satisfied with us. We are just waiting the certificate of we are just waiting for the certificate of accreditation, which is going to come maybe any moment from now. And then we're already working with other private insurance. We have signed MOU with some already. We have signed contracts, and we are still doing back and forth. You know, sometimes when they come with their prices. We look at the prices again. We say, no, these prices, we cannot offer these services at this amount. We send it back to them. And then when we reach an agreement, we sign a contract.
Oh, okay. All right. So, you know, some of the challenges that citizens are facing is that by the time they get to market today, and then buy a particular product at a particular price. They are not sure that if they get to the market tomorrow, that will be the same price. So many persons, what they bought last week, by the time they get to market today, carrying the same money, they will end up buying less of that.
Yes.
And it's a challenge. Does it also apply to your service? Are you changing your prices?
Yes.
All
There are some of the prices that are fixed. We have in control. In pricing, there are some variable factors, then there are some fixed factors.
Okay.
Like some of the prices that are fixed, like our consultation,
Okay.
our admission, our surgery fee, you get it, they remain static.
All right.
You get it. Those ones remain static.
For a
But
long time.
we use, yes, for a long time. But since we started, we've not changed the prices of all these things. But there are consumables that we use. You go to the market to buy.
Yeah.
So our billing system is in such a way that whatsoever you buy, our staff have been trained. Those are the pharmacy, those are the lab. If you go to the market, and then we have a markup. For example, if the markup on a particular consumable or drug is 20%, so your cost price will determine the selling price.
Yeah.
You get it, because you cannot operate at a loss. Hospital is a business.
Exactly.
So if I go and buy drug 10 naira, you don't expect me to sell it 8 naira since I've been selling it 8 naira before. No, I'll buy it 10 naira and then put a markup. Maybe I will sell it 12 naira, basically. So that's how we operate a system that takes care of the current economy.
Okay. Hello, viewers. We have been with Dr. Danjuma. He's a medical director of Epson Hospital, and we have tried to understand how he is, battling with the economic situation, being a business owner, and he has actually made us to know that it's affecting everybody. So, if you are a patient, also know that what you are facing is also what they too are facing, and we must, strike a balance so that we continue living despite its challenges.